intended.
Knowing more about why and how and
Amy Hill.
Hi.
Welcome to the ICCE Training of Trainers.
I'm actually a mental health and drug and alcohol administrator. I work for a county board in Ohio, and we have 2 counties that we oversee the public behavioral health care system.
Great.
And we're looking to have all our agencies that do clinical treatment to use the
Anything at all?
Well, I think it is helping. It's helped me to focus on what the real important things are. There's a lot of information, a lot of readings that we had, and to kind of synthesize all that information into what's really important to focus on, and just help me feel more comfortable in being able to share it with other people.
I'm Scott Ruplin from Portland, Oregon. I work at Kaiser Permanente. It's very sensible. It's not the way it's presented. There's no, it's not hype. It's not a sales pitch. It's not a new package. It's an add-on that people can use whomever they are, whatever their style is, however they like to practice therapy. But it engages the patient in a way that's likely to make their style more effective. People who are happier with what they receive are more likely to continue to purchase that insurance. You'd think the message would get through that it's cost effective not just for the clinicians and at the front street level, if you will, but that the administrators will also help the organization to have deeper pockets and to thrive, as they say in Kaiser.
Hi, I'm Portillo Miller, and I work for the Counseling Center of Lakeview as a clinical project director for one of the programs that we were funded through SAMHSA to serve homeless adolescents. The mission of our agency is that we actually try to serve the marginalized population. And I saw where this particular style of service delivery would give them power, empower them, and give them a voice. But also, I am in the state of Illinois, and we're broke right now. And so community mental health agencies like mine are suffering. We're a small community mental health agency that's strong with values and is the love for people or those who are struggling, who do not have resources. And we want to stay alive. We want to be able to continue to provide services. I believe that if we can incorporate this approach into the way that we service our population, we will continue with our legacy, and we will continue to be able to make a difference in the lives of those who have mental health challenges. Well, one of the hugest challenges is that our youth are not able to connect in your traditional service delivery systems. And so because they have a lot of trauma that they experience and they do not have access to supportive resources and lack the skills and even being able to create those kinds of support networks for themselves because they've been surviving. Now, in my program, we've been successful in changing that way. We have a waiting list of youth who want services, but I have not in the past been able to show scientifically how what we does work until I found CDOI.
Hi, I'm Bob Bertolli from St. Louis and Maryville University in St. Louis, and I also do clinical work at Youth in Need and the ability to train people more effectively in CDOI ideas and being able to take those back to their settings and use them in a very practical way and to spread the message that there are ways to improve our outcomes that are actually very much based on a firm research foundation and based on what we've learned from years of effective therapy.
They say that they receive from your agency that right here, and then it cuts out.
Real crucial.
Because we've implemented the outcome-informed piece in our agency, and we want to make sure that we are continuing to do it the right way.
The culture of feedback is an interesting phenomenon. I'm a clinical supervisor and supervisor of supervisors. And being the vulnerability that is often necessary to really use a culture of feedback is something that I found myself and many clinicians are not have that come too philosophically. People can buy into it right away. The actual practice implications become a much more complex issue.
In what way? What?
The integration of actually using the concepts of effectiveness and enhancement and really bringing that into practice, the implications.
Being here at the TOT, is there some takeaway about how to make that implementation process more seamless?
Oh, absolutely. What we've found, though, in our discussions is that we probably need to go back and do some foundation building, particularly with our supervisors, because we realized that how we implemented maybe wasn't that seamless piece of work you want, and so we're going to go back and put some elements that we've been taught here into place.
Is there
I'm Dr. Richard Hoover. Just returned from being overseas and working with the military adolescents and families for the past 8 years, where we implemented the client-directed outcome-informed approach.
Pretty much all over Western Europe, isn't that right?
And then currently I've taken a position as an associate professor of addictions counseling at a university in the Midwest.
Richard, truly, at this year's Training of Trainers event, you're one of the more experienced folks here using the measures, etc. Is there a takeaway from this experience over these 5 days, given your very broad and deep and long experience with CDOI?
Yeah, I think it's like how do you switch gears, change hats, change roles from being in a place where you're doing it, you're seeing clients, you're doing clinical supervision, to moving into that different role of how would I articulate this, what other tools would I use as a trainer as opposed to a clinical supervisor or a clinician.
Hi, I'm Nick Drury. I'm from New Zealand. I'm here because I'd like to see CDOI spread through New Zealand a lot more than what it
And as
does
somebody
now.
who's very experienced with the message, is there any take-home from these 4 days so far at the TOT? Anything at all that you put your finger on?
Yeah, I feel a lot more confident about sharing it and inviting others to get on board with it than what I was before. And I'm beginning to sort of see how to work around some of the roadblocks. And then